The children I primarily work with are those that experience what we already know, neurological problems such as ADHD, autism, fetal alcohol, fetal drug effects, attachment disorders, and those that have trauma histories of neglect, and some kids that have medical conditions that are neurologically based, like seizures.
Your work with them is as a mental health therapist?
Right, as a mental health therapist, right. And most of the families come because the children are having behaviors that are out of control, and they're trying to find ways of helping them live within their families. The first thing I see is that as soon as you're doing a movement with the client, the families can see almost an immediate response. It may not last very long the first time, but they see that initial response, positive response, which is really great. The families report less meltdowns, better sibling relationships, better sleeping. One young man has Tourette's, and almost immediately a lot of the vocal tics went away, so that was a huge improvement for him. And the clients feel better, they're not in trouble as much, so there's a lot less emotion and conflict going on in the home. So the families are seeing a lot of improvement in their kids. And some almost immediate, some not so fast, but the little bit they see is really hopeful for them.
Can you tell us about the 8-year-old boy you talked about?
Oh, yes. He has multiple disabilities, so cognitive delays. When his foster mom first brought him in, it was because he was very aggressive and was as anybody get close to him, and he was hitting and kicking. So we started doing some rhythmic movement, and he started calming down almost immediately. After about 6 months, when he went back to school, the school thought that he was on more medications because his behavior was so much better at school. He actually was on less medications. And whenever he gets upset now, instead of just hitting and kicking, he'll go find his foster mom and say, I need to rock. And he will get down. And his favorite one is the side rocking, the fetal rock position. He loves that, and that's the one that he's responded to the best. The other thing I forgot to tell you when we were talking about that the other day is that he was getting occupational therapy at the time when I seen him. And the therapist, OT, asked the mom, what are you doing differently? Because what I'm doing is not generating these changes in this child. So since then, he's gone to learn about rhythmic movement because he found it a real positive for them. So
that's great.
It's a good thing. And some of our other therapists that I've been working with are working with attachment issues with some of these kiddos, and one even with disassociation. She's just started doing that. So she's a couple of them are feeling, now they're really confident with it, are kind of moving into kids that have other issues that they're finding are really beginning to be helpful with them too. So it's exciting stuff. Well, I think the most important thing for mental health therapists to look at is to get comfortable with some kids need something other than just talk therapy. We know through research that talk therapy does change the brain, but what we're finding is adding these movements to the program or to their traditional mental health approach is we're finding quicker response, and we're seeing kids much less volatile emotionally, so they're able to do some pretty heavy-duty work that they need to do in dealing with some of the trauma issues and things that have happened to them. So the thing with the family is they see fairly quickly that there's a change. Many of our kids have come years. They've been therapist hopping, trying to find an answer to what's going on with their child. And when we say it's neurological, the family quits blaming themselves. They become much more engaged with the child as it's a problem we need to support each other through. The parents feel hopeful at that point, and it really changes the dynamic of the family when they can look at that. So it's just important, I think, to find things that work with different children other than the talk therapy, or in addition to the talk therapy, that make things go quicker and give the families much more hope. So it's been a great program, I think. And more of this therapists that I work with are getting to know about it, the more they're seeing the benefit of I had one therapist say to me, he does a lot of work in collaborative problem solving, and that program talks about kids that have lagging skills, which are all neurological based, And he came in one day and he said, okay, lagging skills, brain, gotta move to make the brain change. And I said, yup. And he went and took the class. He says, it just is clicking with me, but we've been talking about it for a while. So it is important, and therapists are beginning to see the potential for helping and having one more tool in their toolbox for working with families
That's
and
great.
children.
Thank you so much, Kathy.
You're more than welcome.